Normal movement patterns is the way a person naturally moves. These may be altered slightly depending on the individual, but will still be classed as normal to them. If we understand normal movement patterns, we can use an enabling approach when instructing a person to facilitate their movement and optimize their abilities, independence, and well-being. When we are instructing, prompting, or supporting a person, we can break these instructions down into bite-sized pieces. So basically, the more they do, the less we do. When we're following normal movement patterns to stand from a seated surface, the first thing we need to think about is the depth of the seat. So we may need to shuffle ourselves forward to facilitate the stand. We want our feet below our knees in a comfortable position. Our hands can either be on our lap, on the seated surface itself, or if there are armrests, we can use these for support. We then want to bring our upper body forward, which we sometimes call nose over toes, and then we're going to stand, which is a diagonal movement. When we're following normal movement patterns to sit back down, we do that process in reverse. So firstly, we need to make sure we can feel the seat with the back of our legs. Our hands again can either go on our lap, or if there are armrests, we can use these for guidance and support. We're then going to bring our upper body forward, stick our bottom out, and we're going to control the descent down into sitting. Most people, when asked how they get out of bed, will say, I just roll out of bed, which is kind of correct. But when we're giving these instructions to somebody, it will help to break this down into bite-sized actions. So firstly, what we want to be doing is getting ourselves into a lying position on our side. And to do this, we'd bring up our knee opposite to the side of the bed that we're getting off, and then use the opposite heel to initiate the roll onto our side. Once we've done this, we'll then bring our feet off and simultaneously push our upper body up using our elbow and our hand. What we need to remember and think about is that the height of the bed is suitable for the person, so that when they come into sitting, both their feet are flat on the floor so that they're stable and ready for standing. When following normal movement patterns to get back into bed, we do the exact same action, just in reverse. So firstly, we would lie down and simultaneously bring our legs up, use our opposite heel to initiate the roll back onto our back.